So now that we've talked about the definition of obesity and complications of obesity, we're going to talk about why some people are obese, the factors that contribute to obesity. Well, in its basic terms, obesity results when there's an excess of energy expenditure over time, when calories in are greater than calories out over time. So a lot of people will say to me, well, weight loss is really easy. It's just calories in, calories out. And I joke with my friends that I just want to slap these people. Now, in the days of social distancing, that's not real possible. But people think that it's easy, but it's not. There's a lot of factors that influence energy in and energy out, and they're really complex, and they vary among individuals. And some of them include brain regulation of appetite. That varies among people. There's a really, I'll explain this kind of intricate mechanism that controls when people know that they're hungry and full. It's more efficient in some than others, but basically the brain gets signals from the periphery to determine what the appetite should be. Physiological differences between people. We talked about the fact that some people have a high degree of thermogenesis when they overeat. Some people have a high sympathetic nervous system tone that results in increased calorie expenditure. And, some people have a natural high biological desire to be active, and other people are energy conservers. There are psychological factors. Some people are stress eaters, some people are emotional eaters that can contribute to obesity. The environment, now this is what's changed over the years with the increase in obesity since about the 80s. The food environment has changed. The activity environment has also changed. We have a lot more conveniences, and people live much more sedentary lifestyles. Okay. Lifestyle choices, culture. There are certain cultural food celebrations that can contribute to obesity. If you've lived in different parts of the country, you know that there are even different food cultures within the United States. Lack of knowledge. Some people just have a lot of misinformation about nutrition. Like we'll talk about sugary beverages in a bit, but some people assume if it's juice, it's healthy. Whereas juice can provide a lot of calories, but not a lot of satiety value. Some people think if it's chicken, it must be healthy. Doesn't matter if it's fried. So lack of knowledge can contribute to obesity. I had a client one time who drank 3 32-ounce tumblers of cranberry juice a day, thinking that that would be good for prevention of urinary tract infections. And she came to me because she had gained 20 pounds, not knowing why. And it turns out that she was consuming well over 1,000 calories a day in juice. So that lack of knowledge, that's the only thing she needed to change to lose that 20 pounds. Certain medications, psychotropic medications, for one, they can contribute, the ones that people take for certain mental illnesses. There's some that are taken for bipolar disorder and some other mental issues or mental health issues that can lead to weight gain. They increase the appetite. And we'll talk about another drug in a second, prednisone. Could be, habit. I have had habits of stopping at certain places to or from work to get a certain something, and had to change my route to work. A lot of people have a habit of nighttime eating, for example. Okay, there are a lot of medical conditions that can also contribute to obesity, and we'll talk about polycystic ovarian syndrome. We've already talked about hypothyroidism. If it's not caught fairly early, that can lead to quite a bit of weight gain over time. Cushing's disease, we'll talk about pituitary problems or hypothalamic problems. That's an issue with the brain regulation of eating behaviors. And then there's a interesting syndrome called Prader-Willi syndrome. So polycystic ovarian syndrome is actually very common among women. It often goes undiagnosed. It's characterized by irregular periods and fertility issues, glucose intolerance. They're at increased risk for type 2 diabetes, tendency to gain weight easily, especially that intra-abdominal fat, and it's very difficult for them to lose weight. The people that I know with PCOS who have lost weight exercise a lot, and they have to be really careful about what they eat. Hirsutism, which is excess facial and body hair, but they have hair loss on their head. They lose, the hair on their head. It gets really thin. It's characterized by an increase in testosterone in these women. The treatment for it is lifestyle, and there's a medication, spironolactone, that you can take for the excess facial hair, and then metformin helps with the fertility issues and the blood sugar control. This is a picture of a woman with Cushing's disease, which is an endocrine disorder. It's production of excess cortisol over time. And cortisol really increases the appetite and causes increased fat production, especially in the intra-abdominal area. And you can see in this woman, there's a fat depot at the back of her neck. Okay, it's called a buffalo hump. Now, the skin is also really fragile, so you see a ton of stretch marks on their abdomen and other areas. Note how slender her arms and legs are. That's another characteristic. That moon-shaped face is another one. I had a student whose mom developed Cushing's disease, and he was really frustrated because she had gained 100 pounds and she was eating all the time. And he was actually kind of angry at her because of this. And I'm like, look, she has a disease. That is a symptom of her disease, like high blood sugar is a symptom of diabetes. It's part of this disease she has. I would say that Cushing's disease is a secondary cause of obesity. I told you about the current understanding that obesity is classified as a disease by most major health organizations, but I think there can be primary obesity and secondary obesity, and Cushing's disease would be a secondary obesity. The primary issue is the Cushing's disease, which results in the secondary problem, which is obesity. Now, this is a dog with Cushing's disease. I wanted to mention, because I'm a dog lover, that dogs can get Cushing's disease. This is a beagle. They're one of the breeds that are prone to Cushing's disease. So are dachshunds, and I've seen some labs actually with Cushing's. You can see the pot belly, and they do have an excess appetite. I had a dog who was a cross between a cockapoo and a beagle, and she developed Cushing's disease, so she had a little pot belly. And yeah, people did make fun of her, but I tried to boost her self-image and told her to love herself as she is. So more factors that contribute to obesity in detail. Okay. Brain control of appetite. So what makes us want to eat? How do we know when we're hungry, and how do we know when we're full? Why do some people have bigger appetites than others? Well, the brain controls appetite just like it controls other biological drives. So appetite is usually tightly regulated in infancy and early childhood. You may have seen this if you've ever fed little babies. You can see when they don't want to eat anymore. They do the mouth clamp and turn their head away. They know when they're full. Now, you can override these biological mechanisms, especially if highly palatable food is available. But over time, people tend to learn to ignore their hunger and satiety cues. And they do that by restrictive dieting, where they kind of learn to stop realizing when they're hungry with restrictive dieting. And then chronic overeating, when you override, that sense of fullness, can lead to the ability to ignore your hunger and satiety cues. So I'm going to stop there because I'm trying to keep things to less than 10 minutes, and we'll continue with this in the next one.